Welcome to The Explainer. Today we're jumping right into some really powerful evidence behind a specific way of caring for people with ALS, or amyotrophic lateral sclerosis. We're going to look at data that shows how the way we deliver care can literally change the outcome of the disease.
So, for a disease this complex and this challenging, it's the #1 question on everyone's mind. Patients, their families, their caregivers, they all want to know, where do we go? What's the best possible thing we can do?
Well, for decades now, the research has been pointing to one single definitive answer. And it's not some new wonder drug, but a system. It's about bringing a whole team of specialists together in one place, all focused on one patient.
Okay, so let's get right into the most compelling data. And that has to start with the thing that matters most, survival. And the evidence here is, well, it's pretty striking. Think about this, 7.5 months. A huge study in Ireland found that patients who went to a multidisciplinary clinic had a median survival that was over half a year longer. Now, in the context of a disease like ALS, that is an incredible amount of time.
And it gets even more powerful. That same study looked at what happens in that first year, and the findings were just as huge. A nearly 30% lower mortality rate for people getting this kind of specialized, team-based care. That's a massive difference.
So, look, when you line them up side by side like this, the picture is just incredibly clear. There's no ambiguity. The multidisciplinary approach shows a consistent, significant advantage when it comes to extending life.
And here's the thing, this isn't just a fluke finding from one country. We see this same pattern popping up all over the world. A study in Spain found a 6-month survival bump. Data from Belgium points to the exact same conclusion. The benefit is real and it is consistent.
But it's not just about adding more months to life, right? That's what's so important here. It's about adding more life to those months. And the impact this model has on a person's quality of life is just as profound. I mean, listen to this from a key study with over 200 patients. They found that people in multidisciplinary care reported a significantly better mental quality of life. The biggest impacts weren't just physical, they were felt in their social lives and in their mental well-being. And on a practical, day-to-day level, this model just works better. Look at this. Over 93% of patients in this kind of system had the right equipment and aids they needed, compared to just about 81% in general care. That gap makes a huge difference in someone's daily independence. And because this approach is so proactive, it helps stop problems before they turn into full-blown crises. And what that means is fewer unplanned, super stressful trips to the emergency room, which is an enormous relief for everybody involved.
Okay, so what's the secret sauce here? What is it about this model that makes it work so much better? What's the mechanism behind these incredible results?
Well, first you have to understand the challenge with ALS. It's not just one problem. It's this cascade of really complex issues all happening at once. You've got breathing, nutrition, mobility, communication, not to mention the immense strain on caregivers. Trying to tackle all that in pieces it's overwhelming.
And that's where the coordinated defense comes in. By getting everyone in one place, the team can spot issues way earlier. That means they can be proactive. They can bring in breathing support or nutritional help at the best possible moment, not after a crisis has already hit. It's a total, holistic game plan.
And this really gets to the heart of it. The magic isn't in the building. It's in the process. It's the respiratory therapist talking to the dietitian, who's talking to the neurologist, all in real time, all focused on the same person. That is the secret.
All right, let's bring all this home. What does all of this data actually mean for people who are facing an ALS diagnosis right now?
It means that, based on all this evidence piled up over years, this type of care is no longer just a nice-to-have. It's officially the standard of care. The American Academy of Neurology flat out recommends it. This is what best practice actually looks like.
Now, we do have to be totally transparent here. This evidence comes from what are called observational studies. They aren't the absolute gold standard, randomized clinical trials, which frankly would be almost impossible to do for this kind of question.
But, and this is a really big but, when you see the exact same positive result pop up over and over again in Ireland, in Spain, in Belgium, across totally different healthcare systems, well, that conclusion becomes incredibly persuasive. It's hard to ignore.
So let's just recap the big takeaways. This model delivers real, tangible, life-changing benefits for people with ALS. We're talking more time, better quality of life, better day-to-day support, and fewer crises. It's that simple. And that really leaves us with one final big question to think about.
If this kind of coordinated, team-based approach can so dramatically change things for a disease as tough as ALS, what other complex chronic diseases could be totally transformed by the same idea? It really makes you wonder about the future of healthcare.